this morning. You won't have to put up with me singing Once a Jolly Swagman, all right? Now, today we're all set to go to Sean? All right, today we are very lucky. Now, obviously, I've never actually experienced a morning like this at the club, where about the time people were due to turn up or leave their homes, it's massive rain, and wind, everything. And I said, oh, a lot of people aren't going to come. And Dawn said to me, but it's an important topic, emergency. And I said, yeah, but you don't want to create an emergency by coming to a talk on emergencies, right? And if you can imagine motorbikes, flood and wind, massive wind, etc. So yeah, we definitely had a weather-affected attendance today. But it's always really great to have Bangkok Pattaya Hospital come and give talks. In fact, a couple of months ago I met with Edwin in a coffee shop and he asked me for suggestions about talks. And I said, why don't Bangkok Pattaya Hospital give a talk on where they are undoubtedly the #1 hospital? And where they are the #1 hospital is emergencies, right? They really get up on emergencies, ambulances, strokes, heart attacks, and of course, maybe Pattaya could be just as good, but it's like half an hour further on. And what you don't want if you had a stroke is like to wait an extra half an hour, because the strokes time is brain cells, right? So, if there's an emergency, really, Bangkok Pattaya Hospital should be the first hospital on your list. And we are very blessed because we got Dr. PEMISA, have I got a pronunciation approximately correct?
Yes.
Has come, and she's an emergency doctor, so she's going to give this emergency talk. I hope there's some last minute changes to her PowerPoint. And so, of course, being an emergency doctor, there had to be a last minute emergency. Of course, she's used to that. All right. Still going on? Are we ready to start? Hasib?
Again, Chris.
You want to come up and start the talk? Yay! Big round of applause for Dr. PEMISA Emergency, Bangkok Pattaya Hospital.
Thank you very much. Okay, thank you very much. Good morning, ladies and gentlemen. I'm an emergency doctor from Bangkok Hospital, Pattaya. My name is PEMISA JARCAU. Today, I would like to represent about the ambulance service and the emergency department of Bangkok Hospital, Pattaya. Okay, I'm not sure that in here have anyone used to call the emergency ambulance from Bangkok Hospital, Pattaya or not? Is there anyone used to call? I hope no one used to call my hospital. But by the way, in case you have to call ambulance, in case you are in emergency condition, which number you will call and which hospital you will choose is going to be the most important to make a right choice. So today I would like to tell you that why you have to choose Bangkok Hospital Pattaya today. Okay, so we will start with some video presentation to show about the emergency ambulance and the process of emergency room in our hospital. Okay, now we prepare the video and the slides. So if you have some question in your mind, please prepare for the last session, because today we're going to answer all the questions that you have today also.
Just out of interest, has anybody ever been in an emergency situation yet that they had to get to hospital as soon as possible? Anyone? Oh, we've got at least one. Well, we'll have to get your two. So we've got a couple of people put their hand up. Anybody had to? 3. Thank you for sharing. And anybody else had to actually take someone or encounter an emergency and have to make a decision about what to do with them? A friend or something like that? Have some sort of emergency? Yeah, so this is very important information for yourself and for your friends. This wasn't an emergency, but I suddenly had a phone call a couple of months ago about I've fallen over and I've dislocated my shoulder, so it was a breakage. So I took him to Jomtien Hospital because it wasn't an emergency, but if it had been, Bangkok Hospital Pattaya would have been on the top of the list. All right, we're good to go.
Okay, I will start with the presentation. Bangkok Hospital, Pattaya. Our hospital is certificated by the Trauma Center. Okay. So for the Bangkok Hospital Pattaya Emergency Service, we are certificated as the Trauma Center of the Level 2 of Trauma. Okay, by the Royal College of Surgeons of Thailand, and we are also certified by the camps and the camps of the EU. It means we certified as the quality of the trauma and the medical transport team. And Bangkok Pattaya has been awarded the Corporate Social Response Award from Healthcare Asia Awards 2019 also. The award came from the hospital promotion of the importance of CPR as life-saving skill for emergency situations in the entire community. And immediate application of CPR technique increases the chance of survival and achieving optimum treatment results. The rescue project has been developing over the past 5 years and spreading life-saving technique and first aid training, including CPR and AED training. And individuals as well as the Department Disaster and Prevention and Mitigation and estimates that more than 20,000 people have been successfully trained. And for this reason, rescue project will continually develop because we believe everyone can save life. And what is why making the right choice in a medical emergency is important? First, all the emergency situation, every second is count. According to the saving life, like we will save your organ, like the heart or brain or your extremity. It's important because every second is important. By understanding how Thailand ambulance system works and can make life-saving difference, the choice you make in those critical moments determine how quickly and effectively you receive care. This session will help you be prepared and make information decision and ensure you and your loved one get best possible medical assistance when it matters most. And how does ambulance system work in Thailand? We divide into types. First, we're gonna call like a volunteer or government ambulance. The number you can call is 1669. And what is the benefit of this? Because it's free and it's relatively fast, response 8 to 12 minutes. And actually it can provide basic response and advanced response. But it depends on the ship complaint that you tell them when you call them. If your ship complaint is you want to not emergency, they're gonna send the basic team to pick you up. But if you call them and your ship complaint is as the emergency condition, they're gonna send the advanced team to you. But by the way, they will take you to the hospital, the nearest hospital that you call them. And it's not, you cannot make your choice by yourself that which hospital you want to go. But another ambulance service is called private hospital. In this area, we have many private hospitals, and our hospital also have the system also. You can call 1719 directly to our hospital. And after you call us, we're gonna send all advanced team. Even you call in emergency or not emergency, we're gonna send advanced team to you. And we're gonna take you directly to Bangkok Hospital. And I will, in the detail, when you call 1669 and 1719, what is different between you call the government service and the Bangkok Hospital? First, when you call 1669, the post said they will have the like a center of the dispatch in the government hospital, And after you call them, they're gonna receive your data about the chief complaint that you say, like you have chest pain, you have diarrhea, and then they're gonna separate you to emergency and non-emergency condition. If you're in emergency, they will send the advanced team to you. The advanced team is including nurse and some equipment, but the basic team is gonna be volunteer staff. So if you divide to emergency or non-emergency, they have to make a decision, so it takes time 8 to 12 minutes before the ambulance go. And mostly they're gonna send basic life support to you first, and after that they're gonna send you to the transport to the nearest hospital near your residence. And if you need the special care after you arrive at the hospital, they're gonna do the transfer system. So total time of the right care is gonna be 45 to 90 minutes. And what happened when you call Bangkok Hospital Pattaya directly 1719? After you call the 1719, we have our own dispatch center, and we're gonna take 2 minutes to make a decision to send the ambulance to you, because we don't divide you to emergency and non-emergency. We have the advanced team that including doctor, nurse, and practical nurse to you. So we're gonna take time rest for 2 minutes, and after that we're gonna send you back to our own hospital. And moreover, we have more benefit, because if you have the problem about the language, about the translation, we also have 24-hour multi-language support that we can translate. We have translator more than 20 languages. And we also have the staff to take care about your infection insurance handling. And we have fast process and less paperwork. So for our statistic, that the total time of special care will take less than 25 minutes. So this is the comparison about the ambulance of the volunteer ambulance and Bangkok Hospital Pattaya ambulance. First, because they have to take time for dispatch to divide you as emergency or non-emergency, so they take time 8 to 12 minutes. But our hospital, in case you are emergency or non-emergency, whatever, we send the ambulance to you in 2 minutes. And medical care first, they're gonna send the basic care to you. But our hospital is gonna be advanced care, advanced hospital care. And the hospital choice is gonna be the nearest hospital if the voluntary ambulance. But if you call the Bangkok Hospital Pattaya ambulance, they're gonna direct to Bangkok Hospital. And in case you arrive to hospital and you need some specialist take care, like cardiologist or neurologist, you have to, maybe some hospital not have the specialist, you have to be in the transfer system. But if you arrive in Bangkok Hospital, we have all specialists, so you're gonna get immediate specialist care. And about the insurance support, in some government hospital not handle about insurance support, but in Bangkok Hospital, we have the staff to take care and about your insurance in fast and efficient processing. Okay. From now, and how to prepare if you call the ambulance. First, you have to prepare your passport. In copy or the real one, you have to prepare passport. And the second one, please prepare your copy or the real card of the insurance. Because when you are in emergency condition, we can provide you the pre-register by the ambulance nurse by bringing your passport to the hospital before you arrive to hospital. So in the ambulance, we can do the pre-register for you also. And so please, another one is save the BPH number, Bangkok Hospital Pattaya number 1719 on your phone and pin it for easy access. And please inform your friend and your family about emergency procedure. Okay, and after you understanding emergency, system. Now, the next is many people worry about the emergency, medical costs, and insurance. I will inform you about the hospital bill payment in Thailand is very different on the several factors. It depends on type of hospital, government or private hospital, and level of care of required, like a routine treatment or specialized emergency treatment or procedures. And the insurance cover is like a direct billing or an upfront payment. But by the way, without insurance, medical emergency can be expensive. Most private hospitals require upfront payment like a deposit if insurance details are not available. Common mistake that we always found in emergency is like the first one, the top emergency medical mistake is you calling the wrong ambulance service, can leading to the delay definite treatment and not knowing which hospital they will taking to you. And moreover, if you not prepare the insurance details, it can be delayed treatment also. But by the way, in emergency room in Bangkok hospital, we can do emergency process without waiting for this all. And assuming all hospitals provide the same level of care, because many hospitals in Thailand not have all specialist doctors. And some hospitals waiting too long before seeking the medical help. So it's very important to make the right choice to call the right ambulance to you. So in conclusion, why Bangkok Hospital Pattaya? Because we are internationally accredited and high quality medical care. Our emergency doctor have the certified about the trauma, advanced life support, basic life support, and the pediatric life support, or certification that update. And we are fast and reliable and specialized emergency care. And we are international patient service, and we have multilingual support. Also, we have hassle-free insurance processing and pre-registration for you in the ambulance. And we have comfort and premium healthcare experience. So for the conclusion about the medical service in emergency room, in Bangkok Hospital, we have the most updated technology and facility. And we have the specialists available for 24 hours. And we have more than 20 language translators. And we also have the staff to take care of your insurance handling. And we have the shorter waiting time. So we sincerely hope you will never need it. But just in case, a free ambulance service is available to support you when it matters most. Okay, that is the preview about my hospital. But by the way, if you have any question and any problem that you used to experience, you can ask and we're gonna get the answer for you. Thank you. Yes, please.
My name is Kelvin Banfield from Thai AAA Law. Many of my clients have a living will, which is do not resuscitate. So if there's an emergency, how would the hospital know to not resuscitate?
Thank you for your question, because it's very important for the emergency decision also. In Bangkok Hospital, if some patients have their history of the treatment in hospital, some people have the document about the living will in the document that record in the hospital system. So if in case the emergency staff alive, first we were gonna call directly to the dispatch center to check about your patient, the patient name, and check about the patient information that patient used to have the record of the living will or not. If the patient never have the record of living will, if If he or she still can speak, we're gonna ask them directly that you want to definitely do or you want just supportive. But if they cannot answer, we're gonna have like relatives or his wife or her husband or their son or daughter can make a decision also. And we're gonna have after you arrive to emergency room, you have to sign to do not resuscitation. But I have to sincerely to tell you that if the patient stay alone and have no one to make a decision, the first we can do is just do the resuscitation first, because we cannot make a decision by our own. So if we find the patient stay alone and in the crisis, we have to do the resuscitate. And after that, what we can do in the ambulance is like an incubation and the CPR. And after that, we arrive to hospital. We can contact to the lawyer or to the relative, and we can make a decision at the hospital also. So so maybe, I don't want to talk like this, but if you have the condition, do not resuscitate, please put it in your bag. And when we see it, we're gonna make a decision.
I put in a living will in Bangkok, Pattaya Hospital, well over a decade ago. Would that still be there?
For the kid, I think it's very difficult because the update of computer is maybe in 10 years.
Okay.
Yes. But by the way, if you have the do not resuscitate the record, but when you arrive to hospital again, you have to make a new one also.
Also, let me just say this when I think about it. Somebody told me that they have friends that might go out at night and stuff and they leave the phone in their room. Are you kidding me? The phone is like one of your most important safety devices, right? Michael Mosley died on a Greek island because he forgot his phone, right?
Okay, two questions. So you had mentioned that it's very important to have your passport and your insurance card. And I think Ren hinted on this as well. A lot of us have it in our phone, but if for some reason our phone is destroyed, how could we get that information to you? And what if we've been to Bangkok Hospital before? Is it already in your system? Could you utilize, do you save our passport and insurance card if we've ever checked into your hospital?
Okay, we have to divide, thank you for your question first, but we have to divide two types of patient. The first patient who never registered to hospital the first time in hospital and have the problem that no passport or no insurance, we're gonna have the system that register for you, the new one, by put the name like a John Doe for you first. And after that, we can get the real name of yours, and then we're gonna put the information, because we don't want to delay about the treatment, so we have to have the system about this. But another one, if you are the patient, you used to be the patient of Bangkok Hospital and have the hospital number before, we're gonna get your name and your last name and your birthday. So we can specify that this name and this birthday, we have the register before, and the staff will come to check to you again to confirm, because it's very rare to have the same name, same last name, and same birthday, but it can be. But we have the staff to manage about this, to see your own passport, if that is copied in the record, that the same face or different face or not also. So is the answer? I'm not sure that is okay or not.
Yeah, that answers the question.
Yes, and about the insurance, if you worry about this, we also have the staff to can, if you used to be the patient in our hospital, we also have the staff to take care about the insurance, especially because they will contact to the company for you. Yes.
So, some people like Short George here, he actually proactively went and you put your insurance details with the hospital, yes?
Yeah, prior to being admitted to the hospital, I had stopped at the Bangkok Hospital Pattaya and given them my paperwork for my insurance, copy of my passport, so that when I was transferred via the ambulance. They just asked me where I wanted to go, and I said Bangkok Hospital Pattaya. Of course, I wasn't in any state to know where I was or who I was, but they got me there, and then all the paperwork and the insurance and everything was taken care of. So I would suggest to anybody, do that ahead of time. If you got a little spare time during the day, take all your paperwork there to the hospital so they have all that there, because otherwise you're just kind of out on a limb.
And isn't it great to have George back in the room? Round of applause. So, for those of you who don't know, he got hit by a speeding motorbike on Sobu Cow. We have graphic footage of that, which we're going to show one day. You don't have to look at it though, okay? All right, what next question?
Is there a necklace or bracelet one could wear that would alert emergency providers to your pre-existing conditions, allergies, or medications you're taking?
You mean like where we take this information, right?
Yeah, I mean, is there like a bracelet one could wear or a necklace?
If in case you go to hospital and we're gonna take care of this, right? May I specify the question? It means if you arrive to hospital and you have the some property or something like this, we have the admission of staff to take care of this. If you have some people come with you and we can confirm that it's your relative, we're gonna take it out and give to them. In case you need some investigation that need to take it out. And like to do the CT scan or MRI, we have to take it out and we're gonna give you to the relative, or we will give you to the admission staff, and they're gonna record, take a photo and keep it for you. In case you discharge, you're gonna get it back or something like this.
Okay, that's not exactly what I was asking. So if I'm laying on the street and the ambulance comes, bracelet that has like a red cross on it.
You mean the red, like a cross of the specify that you're allergic to something,
So,
right?
exactly.
Okay. Actually, we rarely see. But if we see about this, we can detect it and explore about this also, because now it's easy to get information about this by searching or
Right.
something, because it have some people about the blood transfusion, we have problem also. Then they have to wear the wrist like this, and we're gonna take a photo and searching and see that this is like some kind of some sign of something or not. Yes, we mostly emergency doctor we do their response about that. Yes,
Right.
but it's, I have to confess that it's very rare. But we used to see also like some people doesn't want the bus. Some people don't want the bus car thing or something like it. They're gonna have the side here also, and some allergy is gonna have side here also. Yes.
Does the hospital have a foundation for that?
I think we not have the process about it exactly. It depends on the nurse and the doctor who on duty that they are gonna make the process, and after that they're gonna put the information into our program, and we have the pop up about it. In case next time you come again and you have no wristband, you can still know about your history by the allergic pop up or the specified pop up in the computer.
I just had a wild idea. Maybe we should get a QR code tattooed into our bodies and put the QR code and it comes up with allergies and everything's and living well. I mean, it's not as stupid as it sounds, is it really?
It's very good idea.
Anyway, good on you. Good on you, John. All right, some more questions. Well, it's a bit of a shame some people probably didn't get here because of the weather, but how important is this sort of knowledge, right?
Good morning, and thank you for attending. For Thai citizens that belong to the Thai Social Security system, can they come to your hospital, or do you send them off to another hospital?
We have to, actually my hospital is have like already in the part of 1669 the volunteer ambulance also. So in case they call us directly, we have to divide to two cases. The first case, if they call, even they are Thai people, they call 1719. We have to directly send them to our hospital, even the emergency or not emergency, and we're gonna take care of them in the right that they should have. And if in case they call 1669 and they are in emergency, we will direct transport them to our own hospital for you. But if they're not in emergency condition, we're gonna find out that which hospital they want, because we can make a decision, because we are advanced team, we have the doctor in the car, so we can make a decision that this case have to be in the nearest hospital or in the hospital that patient require or not. So we have to define that what number they call and what condition they are. If they are emergency, we're gonna make a decision for them. Yeah.
Thank you for your talk, that was great. I've got a couple of questions that are about sort of technical things. One of them is, do you have a 24-hour stenting, like for heart attacks? Do you have an interventional cardiologist who is on site 24 hours? Or,
yeah. Actually, we have the slide about the fast tag process or disease, but it have some technical problem, but I will describe about this. We have all specialists about all the fast tag. We have the fast tag heart attack also. So we have the cardiologist who on in the hospital 24 hours. And moreover, we have the cardiologist intervention also who on duty 24 hours. And if after you have the heart attack, we're gonna have the flow that take shorter time, right? For example, you have the heart attack in your residence, you call the ambulance. After we arrive there, we're gonna put the ECG at the scene, because we can put the ECG in the scene and we can send it directly to hospital by use the Wi-Fi. And after that, if the doctor in ambulance detect that you have the heart attack, they will contact to the cardiologist directly in the ambulance. After the cardiologist see the ECG, and they're gonna say, is heart attack activate to the operation room, then we're gonna send you operation room, but you don't have to pass any emergency room. You're gonna directly to the PCI room to use the catheter. And we also have the intervention of the cardiologist for 24 hours. And in case after you do the intervention and have some complication, we also have the cardiovascular surgery 24 hours also. Yes.
Thank you, that was very good. So is there like a door to stent time?
Yes, of course. I would like to tell you that we have the static that we have to make in our hospital. We have the KPI that we have to do that. About the heart attack patient, we have to send them to the catheter in 60 minutes. Yes. If it's something like more than 60 minutes, we have the review to the review that why delay, something like this. Because we have the KPI time that if you have heart attack in 60 minutes, you need to get the catheter.
That's great. That's a great international standard. Now, the other one I wanted to ask about is for people who have a stroke. So just say they have an ischemic stroke and they have a clot lodged in their brain. I want to know, do you do clot retrieval, or what happens with somebody with an ischemic stroke?
First, in our hospital also have the stroke fast track pathway also. If first you can detect the stroke, as you see in the internet, that FAST fast, the facial palsy, the arm drop, or the speed incorporation, and your time. How many time that what time that you can, how long that you can detect whatever. After you call the ambulance, and the ambulance doctor arrive to your residence and detect that you have the stroke, they will call the neurologist doctor in the ambulance and tell their information that we suspect that the patient gonna have the stroke. After you come to hospital, we're gonna send you to the MRI or CT scan directly, because we can give you the medicine calling RTPA, like in onset of the stroke 4.5 hours. Or we can, if longer than 4.5 hours that you detect yourself, we also can do the thrombectomy by the intervention doctor. So we can give you medicine also, and we can do the operation of remove the clot for you also. And in case you do the CT scan or MRI scan and show that you have the hemorrhage or bleeding in the brain, we also have the neurologist surgery to do the operation for you 24 hours or so. Yes, so no worry about this.
Thank you, they're great.
Yeah.
They're the best thing you can
Actually, I want to talk about this because you asked me about this question in the restaurant, but I prepared the slide, but we cannot insert in the computer. That is very sad for us.
By the way, you happy with those answers?
Yeah, they're very good.
Dr. Davey here was a doctor in Australia that specialised in emergency care. So if he's happy, you know, it's ticked a couple of big boxes, right?
I do some mistake on
Hello, thank you.
yes.
Interesting talk. Unfortunately, I've got a 40% loss of hearing. So if I'm repeating myself, I do apologise.
Okay, I'm sorry if my voice is too wrong.
Yeah, I come from England and I was a paramedic for 20 years. So we have a different system to you, but I understand the volunteer side of it for national. I presume that's national volunteer. Yeah, and that you specialise in turning up with a doctor and nurse and all that. But I have to give advice here a little bit. If you have an emergency, no matter what it is, not a busted leg, that is no emergency unless, I like to categorise that. If you're bleeding, then it needs dealing with. But in an emergency, a heart or a stroke or anything like that, please go to the nearest hospital, get stabilised, and then you can think about transferring to a specialist unit, which Bangkok Hospital is, I agree. So that is most important. It's no good travelling 3/4 of an hour dead, because that much can happen. We turned out in England within 8 minutes, and hopefully different hospital situation, every emergency had a qualified consultant, always on duty, an emergency consultant, so it's different. But Bangkok Hospital, I dealt with Bangkok Hospital in my own capacity. I had injured, came off my bike, and they dealt with it very efficiently. After about 10 days going to and from it, getting dressings, and completely healed. So it is important to go to a good hospital. I must bring something up. It happened about 5 years ago now, maybe a bit longer. This American guy on his motorbike, wearing a pair of shorts, a t-shirt and flip-flops, hit by a car, never stopped. He was obviously seriously unconscious and probably internal bleeding. The crew that came out was a volunteer crew from somewhere, could have been anywhere, and they took him to a private, I'm not going to mention the hospital, but they took him to a private hospital, and the thing they asked for, whoever took him in with him, where's your insurance? And they wouldn't deal with him because he got no notification. So they didn't stabilise him. They shoved him in an ambulance and sent him to a government hospital. About 3/4 of an hour away, he died on the way. There was such a big stink about it from the American embassy because this boy was attached to the father from an American embassy. So everything falls downwards, right? And there was a government order came out that all private hospitals and government hospitals have to give free treatment. The word is free, you can read it up. Free treatment to stabilise you.
Yeah.
Then once you're stabilised, as long as you've got enough blood in you, you can usually survive a transport to another hospital. But always go to the nearest hospital first. these people are there for experts. A lot of these smaller hospitals have got good doctors, but these guys have got the experts, Michael. Thank you.
Thank you for sharing your experience. I understand that some experience very sad about this. Thank you for your experience. Yes. Actually, in Thailand, the paramedic it just started maybe less than 5 years. And I hope if in Thailand have more paramedic in volunteer ambulance, I think they give the chance of patient to survive more also. Yes. But anyway, I'm sorry to hear about that. Yes, please.
I've noticed that the doctors in Pattaya tend to work for more than one hospital at once. They will work for Bangkok Pattaya Hospital, but then you can see them again at another hospital. Is this a normal thing, that the doctors will work for a number of hospitals?
Actually, it's normal for Thai doctor.
Yeah.
Yes, but in the private hospital, always have the rule about this because we need the doctor who have the quality of working also. So you mean that many Thai doctors work in numerous hospitals, right?
Yeah.
It's very actually it's very normal in Thailand because some doctors work in the government and the private hospital for part-time or for the night-time. It have a lot in Thailand.
Yeah.
But by the way, some private hospital they give the quality of the doctor by see the KPI of the treatment of the doctor. So we have to be careful of the triad doctor that cannot go take care of the patient. So many private hospitals have the review about the doctor, about the treatment patient. If the doctor have too much treatment, too much duty, they're gonna talk about this. But I think in government hospital, it's not have this system to take care because they cannot control all the doctor. Yes.
So, certainly, of course, Bangkok Pattaya Hospital and Jomtien Hospital are part of the same group, and very often Bangkok Pattaya Hospital doctors, dash over to Jomtien Hospital for a few hours. They've got patients there, and so yes, so you'll often get the same doctors in those two hospitals.
Yes.
Oh, possibly one last. Don't know.
Thanks for the speech. Do you recommend any insurance companies? AIS, Alliance, etc. or not? Okay.
You mean recommend insurance? I'm sorry, I cannot do that. Because the moral of the doctor, I cannot recommend any insurance for you. Sorry. But by the way, you can ask the officer. But for me, I'm sorry that I cannot recommend any insurance for you.
You can ask that question in open forum, and people can share their experiences with different
Yes,
insurance
good
companies.
idea.
But obviously, a hospital can't endorse an insurance company.
So I'm relatively new in Thailand, and coming from the U.S., the doctors are compensated mostly by tax dollars. So I'm just curious, private doctors, they're obviously compensated by Bangkok Pattaya, but then if they go work at a government, does the government also pay them?
Sure.
So are they being paid both sides?
Okay, first I have to say welcome to Thailand.
Yeah, thank you.
And for the private hospital, we're gonna divide two types of the doctor in the full-time and the part-time doctor. For full-time doctor, we have the side that we not work in other hospital. But if the part-time doctor, maybe they come from the government hospital mainly, so they will get the money from the government hospital mainly, and our hospital we're gonna be like an OT or part-time payment for them. Yes.
So it would be more advantageous for the doctor to work for the private because they're going to be compensated more, right?
Actually, it depends on what private hospital, because it's not all. What is the benefit? I think is the benefit is that hospital take care about the doctor and the patient. How, like in Bangkok Hospital Pattaya, or the full-time doctor can get the education for update. Like they send us to the meeting to update knowledge, and they send us to have the certification about everything. Like emergency doctor might have the pre-hospital trauma and the advanced trauma or advanced life support certification that support by the hospital. So I think the benefit is come from here more than their salary. I think it's the benefit that we can update our knowledge, because in private hospital have the idea that want the doctor to update their knowledge and they will support. But some government hospital they have to support themselves to knowledge, something like that. Yeah.
Over to your left.
Yes. Do they have general practitioners at the hospital, or are they outside the hospital?
We also have the general practice hospital in the check-up department. Only the check-up department, and they're gonna see only the normal blood test or normal patient for their like a certification for driving license, for the check-up, and if the blood is show abnormal, the general practice doctor have to send the patient to the cardiologist or the endocrine doctor for the specialist. Or yes, but we also have a general practice doctor in their check-up OPD.
Well, I'm trying to think of when we've had a more important talk at the club, and I really just can't think of one. A huge round of applause for Dr. PEMISA.
I'm sorry, I have to answer you one more question. I have one more answer.
Oh, one more?
Yes, that you asked me about if you have the trauma, like a stab wound and something like a fast-track disease. That I already talked about the fast-track heart attack and the fast-track of the stroke. But if you have the trauma, like a falling from the building, falling from the height, and you get a motorcycle accident, I hope half of you in this room, like on the motorcycle in Pattaya, right? It's very dangerous. But if you have any accident or any stab wound, please stay still and call us. We will prepare our equipment for you, so you don't have to do anything. Okay? So please stay still in the safe place, and we will hurry and directly to you. Yeah, so please not worry about it.
Well, a huge round of applause on such an important subject, and really small token of our appreciation.
Thank you very much.
Yes, I'm giving myself a little pat on the back for suggesting this topic to Bangkok Pattaya Hospital, because they are undoubtedly the premier emergency hospital, and so one thing to take away from this is think about setting your phones up better for emergencies, okay? If you go on YouTube and whatever your phone is, Apple or Samsung, put in Samsung set up emergency calls and stuff, so you can be better equipped to. And there is also on the website on pcec.club, you'll see that you'll be able to find pretty easily a page with emergency numbers on it. Okay, very important. And also think twice about riding motorcycles. Okay. Because let's face it, it's not exactly a piece of cake. And you're going to come up and share a little bit with us about hypertension. This is Kunji's, a very treasured member of BPH.
Good morning, I'm Jees from International Marketing, Bangkok Pattaya Hospital. I would like to introduce our event. As May 2025 marked as the World Hypertension Day, so Bangkok Hospital Pattaya recognized the importance of raising awareness on hypertension and supporting your well-being. So Bangkok Pattaya Hospital is going to organize the webinar on hypertension on this Friday, during 2 to 3 p.m. via Zoom link. This webinar is free of charge and all of you are invited to join. Our doctor cardiologist specialist will be presenting in this webinar. To join us, please scan the QR code here to register. After that, fill in your name and your email address. After that, we will send the Zoom link access to your email before the event date. Thank you very much.
So of course hypertension is high blood pressure, of course. So now we're going to move on to the next phase of the day, which is one of our members' interviews. And we're going to start off with, we had one for one with Liz, and now we're trying to concentrate on throwing members of the committee under the bus. Introducing you and saying getting to know members of the committee of the Expat Club. And
I don't know whether we want chairs up there.
try it with chairs. And
Well, we're going to be using slides as
are we
well.
going? Have you got slides there, Sean?
Yes.
There's a presentation for that.
Yes.
Oh, okay. But you can follow it from here.
To talk to the slides.
Yeah, but you can follow it. You can see.
Okay, then let's move this. Let's move
Yeah,
this
yeah.
podium and put up chairs. Yes. Good morning, ladies and gentlemen. It gives me a great deal of pleasure to be able to conduct this interview today with one of the PSEC board members, John Horrigan. I spent some time with him the other day and oh my goodness, it's exactly as I thought. You people out here just have such incredible backgrounds and histories.